For anyone living with chronic lower back pain, the thought of intimacy can carry a quiet, heavy dread. The fear of triggering a massive flare-up is often enough to make you turn the lights out and just go to sleep. Over time, that physical limitation bleeds into the relationship itself, creating a frustrating distance between couples. Your partner might notice the avoidance, but misinterpret it. They frequently internalize the lack of physical contact as a sign that they're unwanted, or that you've lost attraction to them. Alternatively, they might withdraw completely out of a paralyzing fear that touching you is going to cause you physical harm. This matrix lays out the central reality. Maintaining physical intimacy while managing a spinal injury requires a trade. You must exchange spontaneous, unconstrained movement for biomechanically optimized preparation. There is no single, universally safe sex position that works for every person with a bad back. Protecting your spine during sex relies entirely on identifying the specific physical actions that trigger your flare-ups in everyday life. Your sex life does not have to end, but the mechanics of it must be intentionally managed, matching your approach directly to your specific pain profile. The first major profile covers individuals whose back pain flares up most when they sit for a prolonged period of time. If sitting hurts, your biomechanical rule is strict. Your spine must avoid forward flexion, meaning bending or curving forward during intercourse. This decision tree maps out the logic. If prolonged sitting is your primary trigger, the structural recommendations break down into two paths based on anatomy. Looking at the female path, the standard missionary position goes right on the red list. This posture naturally forces the lower back to flex forward into the mattress. Instead, opt for side spooning or an all-fours position. Both of these allow the spine to remain in a neutral, extended alignment. If those alternatives are uncomfortable, you have a fallback option. You can place a pillow directly beneath your lower back while in the bottom missionary position to artificially maintain that structural alignment. Shifting over to the male path, the mechanics reverse. Here, side spooning and flat missionary positions both heavily induce spinal flexion, meaning they must be avoided entirely. The safer alternatives are doggy style or a straight arm push-up variation of missionary to keep the back securely extended. The fallback choices here involve placing a pillow beneath your back in the bottom missionary position or having your partner sit straddling you, facing either direction. Beating sitting aggravated pain means abandoning default habits. You are trading pure instinct for structural support, relying on props, partner assistance, or your own upper body endurance to keep the spine out of flexion. The second major profile covers individuals whose back pain gets worse the longer they stand. For this group, the biomechanical rule flips. Your lower back must avoid dipping into extension, meaning you cannot arch your back. This logic map shows the standing trigger pathway, which again branches by gender to account for structural differences. For females, the primary recommendation is the bottom missionary position, but specifically with your knees bent and your feet firmly planted on the bed. This diagram shows exactly why this works. Planting your feet rotates the pelvis, physically flattening the lumbar spine securely against the mattress to prevent any arching. For males with standing pain, the safest options are the side spooning or flat missionary positions. Alternatively, your partner can kneel on the edge of the bed facing inward, allowing you to stand behind them. Preventing painful lower back extension forces you to deliberately flatten the spine. You sacrifice spontaneous leg mobility and a wide variety of positions, but you gain a structurally secure environment. Finally, we have to look at the indeterminate profile, individuals who experience an equal amount of pain, whether they sit or stand. If you fall into this category, your best starting strategy is to stick to either the missionary or side spooning positions. These demand the least overall physical movement from your spine. Regardless of your specific pain profile, there is a universal biomechanical rule that applies to every safe intimacy strategy. You have to actively tighten your abdominal muscles and maintain that brace throughout the entire activity. As this vector graphic shows, that core brace allows you to initiate all thrusting movements exclusively from the hip joints, keeping the lumbar spine locked safely in place. Locking the lumbar spine in a stable position demands active mental focus. You are swapping unthinking physical motion for disciplined core mechanics. The physical modifications required for safe intimacy will fail without the right logistical framework. This checklist outlines the 3 absolute rules of the intimacy optimization protocol. First, you and your partner must openly map out your exact physical boundaries and mutually comfortable positions before either of you initiates physical contact. Having this discussion while you're fully clothed and separate removes the guesswork. It cures partner anxiety and ensures that if a movement needs to be adjusted later, it isn't taken as personal rejection. Second, you establish a hard stop. You immediately discontinue any sexual activity at the very first sign of sharp or radiating pain. It takes high emotional maturity to abruptly halt intimacy and agree to try again another day, but doing so prevents debilitating flare-ups. Third, you follow up with recovery. Apply ice to your lower back immediately following strenuous sexual activity to control postcoital inflammation. You do not have to live in fear of intimacy. By prioritizing clear communication, strict structural mechanics, and proper recovery over traditional spontaneity, you can safely reclaim a fulfilling physical relationship.